Hey everybody, it's Jessica DeMasso with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation, and look who I have with me right now. Yes, that's right, Jenny Schneider. She is back, and now she is the CEO and co-founder of a brand new business called Homeward that is focusing on rural health. Jenny, I am so excited to see you again.
I'm excited to see you as well. It's great to meet you.
Yes, I feel like I got to know you so well while you were at Livongo and like all of the success you accomplished there. And I think everybody's been dying to find out what it is that you're going to do next. So why don't you tell us, you've got a lot of old friends that are coming along with you. One of them is Hemant Teneja, who funded your round here, $20 million, kicking you guys off, launching you into market. But start at the beginning. Tell us about Homeward and what you want to do in rural health.
Yeah, thank you for the question. So Homeward is re-architecting care delivery in rural healthcare markets. And we're doing this as a technology-enabled provider. So we're coming in and we're owning total cost of care for patients who are in Medicare. We partner with the payers and take on the responsibility for that total cost of care. And the reason we're coming in as a provider is that these markets in rural healthcare have seen shrinking healthcare providers. 140 hospitals have closed in the last 10 years, 37 of those during the pandemic. So this is an acceleration. So the rural healthcare America is really in a crisis of access.
This is, I mean, we keep hearing about that. These hospitals are closing. There is like these care deserts, more or less, that are out there. What got you so passionate about it?
Yeah, well, I grew up in a rural town.
Okay.
So I am from Winona, Minnesota, and I grew up. My dad owns the auto parts store.
Oh, no way.
Yeah, and so summer jobs for myself and pretty much all of my friends were driving the Ford pickup trucks around in rural parts of Minnesota to deliver car parts, spark plugs, hubcaps. And so you watched and you saw wonderful people with really tight relationships. And yet the access to care, with these hospital closures, it's increased travel to care by 30 minutes with every hospital closure. And so what happens is people just don't get care. They don't get care because it's inconvenient. They're an hourly wage worker being asked to lose their income to travel to go get their care. And the world around us in urban markets, has really been enhanced with a lot of technology enablement, which you know. And so how do we deliver that to people in a way that's convenient for them and combine technology with in-person?
All right, so say a little bit more about that, because I think that's really interesting, is the blend of technology and in-person. So the tech stuff, the virtual care, I mean, pretty obvious right there, but like, how are you guys doing in person?
Right. Well, I think that, I think the answer here is really a hybrid model. And if you look around the ecosystem, there are other hybrid models that have been delivered, but these have really been in urban settings. I don't think those transport readily into rural markets. I think you have to design technology and services combination for the needs that you're serving. So where we're starting with a mobile van.
Okay.
So we have a mobile van that can fit into the flow of our members' lives, whether that's in their house or in a place where they say, for example, go grocery shopping once a week. We make it super convenient for them. You can then equip them with the remote monitoring components that they need, the access to conferences through telephone, frankly, just cellular enablement, and you can establish that relationship and then deliver the care that's needed.
That was one of the interesting things I thought when I read the press release, is that it's not like totally broadband dependent. So if you are in a really rural area that does not have great broadband access, like that is not a barrier to that.
Yeah, so I think a lot of rural healthcare markets have been ignored because there's not been great broadband connectivity. So it's about estimated between 50 to 70% of rural markets have broadband connectivity. That means there's a fair amount that don't. There's a lot of federal dollars flowing into increasing broadband connectivity. But one of the things that we learned at Livongo is you can use cellular connectivity to actually get information about people and deliver information to them. So you don't have to wait for broadband connectivity. And because there is such a crisis of access, we can't wait. We really have to go there now.
So I know you're in build mode still, you're not launched yet, but like, tell me about the business model or how you anticipate that's going to go. So you mentioned Medicare. So is it Medicare Advantage? Are you guys going at risk on this? Like, tell me a little bit about how that all works.
Yeah, it's a great question. So we today are a tech-enabled provider that is in network.
Okay.
And so we deliver healthcare to Medicare beneficiaries, and we partner with health plans to take responsibility for that total cost of care.
Okay.
So we get paid for the services that we deliver, and we deliver comprehensive services, including primary care and extending into specialty care, really starting in cardiology. We can talk more about that in a second.
Let's do that.
But then also really our goal is to take on total cost of care. Keep in mind that not all payers are ready for total cost of care in the contracting side as well, right? But we believe that aligning that economic incentive is the only way to make real inroads in rural healthcare markets, in part because a lot of the technology that's needed to be able to deliver the care is not reimbursed adequately under fee for service. So if you instead you say, rather than give you pieces, pay you for pieces of it, just say, take the whole thing. We want to take the responsibility to deliver the care and own the financial risk.
Okay, now let's talk about the specialty care, because I think that's a really interesting place to start. Why cardiology?
Yeah, so again, we're starting with comprehensive care, and that includes all of the primary care services. That's actually really important because if you're going to do value-based contracting, it's really hard to contract as an attribution for specialty care.
Okay.
So we are the primary care providers, but in our markets, 70% of all people over the age of 65 in rural markets have cardiac diagnoses.
Wow, okay.
And there's a 1/8 the number of specialists in rural markets compared to urban. So there's not access.
Yeah.
So for us to actually do the right thing for people and to control the overarching costs, we have to have those levers for the downstream costs. I'm an internist, right?
Yeah.
And I account for a measly 12% of the total cost of care. All the specialty care and tertiary care accounts for 88%. So unless we're bringing access first and foremost, and then quality around that, we'll never be able to deliver the outcomes, the experience, or the cost.
Okay. So Jenny, tell me, what's ahead in terms of launching? Have you picked a market yet?
Well, our goal, yes, we have picked a market. I'm not gonna reveal exactly what that is, but you can invite me back and I can reveal again.
There you go, perfect. I love that. Do you have a time frame?
We do. We'll be live in market by summer of this year.
Okay, great. Then we'll talk again in the summer.
Perfect.
We'll see the summer wardrobe. That'll be great. And then I want to ask a little bit about some of the fun stuff around this. So I teased at the beginning, obviously, you've spent your time since Livongo was acquired by Teladoc. You spent your time at General Catalyst. So Hemant's invested into the company. So there's friend there. And then you've actually gone back and brought some buddies from Livongo along with you. So talk to me about what Amar and Bimal are going to be doing.
Yeah, I would say that we have established the one of the top leadership teams in healthcare. And so I'm joined by my business partners with whom I've known and worked over various capacities, and some new diverse people as well. So Amar Kendall is joining us as president.
Okay.
Bimal Shah is joining us as the chief operating officer. We have Aaron Friedkin, who's joining us out of Blue Cross Blue Shield of Michigan, where he did transformative care delivery.
Oh, that's exciting.
It's great. He's an incredible addition to the team. And we have Brian Vandenberg, who's joining us out of the American Medical Association, where he was responsible for a lot of the policy work relative to rural markets. So the leadership team is really broad, and we have a very shared alignment on both the opportunity in front of us and the work ahead of us. Someone said the other day in the panel, they said, that's really hard, and it is really hard, but at the end of the day, to go back into an operating role, I wanted to do something big that mattered. And Hemant in particular is, with his health assurance thesis at a General Catalyst, is a very big thinker. And rural healthcare is in desperate crisis right now.
I would love to hear a little. Can you dish for us about the conversation you had with Hemant about the health? Because I'm fascinated with the health assurance thesis, and I've read his book about health assurance that he wrote with Steve Klasko, and that whole idea of just making sure that the care model is built for what's next and it's built for everybody in an equitable way. I would love to
Right.
tell me your thoughts on that whole health assurance piece and why rural health fits into that for you.
So if you think about it, so the idea around health assurance to me is that everybody should have equal access to care that can keep them healthy, right? It doesn't mean they have to choose to participate, but they need to have access to high quality care, right? That is the health
Bottom
assurance.
line.
That's bottom line. And again, when we look at rural markets, we're looking at 23% higher mortality. A lot of that's driven by access. That's like living in a third world country in the United States. It's crazy. It's not subtle. It's not minuscule. And so the health assurance thesis really fits the rural healthcare market. Hemant will say it's the fourth front door of healthcare. It's been ignored, and it truly has been eviscerated in the pandemic. The hospitals were having a hard time sustaining, and now they're closing, and people choosing to live in rural markets really don't have the care that they need.
How is Homeward going to partner with hospitals? I'm really curious about that. Like, is this going to be the thing that saves the rural hospital, or like inadvertently, are you going to end up taking business away from them?
So we're definitely not competing. So we look at ourselves as care extenders. We look at ourselves as the ability to be into the community and take care of people, understand when people need a higher level of care and refer them back into the hospitals, into the tertiary setting.
Okay.
So it is not a competition. In fact, one of our corporate goals is to increase employment in the local markets where we're going to be, recognizing that healthcare providers are a large employer in that market. So to plug Hemant's most recent book, which is called Intended Consequences,
That's right.
We're really going in with a model of increasing workforce, but allowing people to optimize at the top of their licensure.
Okay.
I just said on the panel that, it's amazing to me that I went to medical school, hundreds of thousands of dollars of debt later, and I spent 50% of my day when I was seeing patients literally filling out forms, right? And so I thought there's definitely a better mismatch here, and that means a lot of opportunity for more job creation and allowing people to work to the top of their licensure.
That's fantastic. I think that sounds amazing. The other thing I wanted to ask you about this, so speaking of old friends, Glen Tullman, when I first read the press release about the way that you're redefining health and care in this rural market, I'm like, that sounds so much like Transcarent, what they're doing, but in the employer space. Any connection there that we need to know about?
So what I would say is we had an incredible team at Livongo, without a doubt. We delivered on big promises and we're very mission driven. This is not a Livongo 2.0, what we're doing, nor what he is doing. I would say a lot of the learnings across the leadership team out of Livongo was the importance of value-based care.
Yeah.
Again, getting to aligned incentives. We're entering a very different market. Glen's in an employer market, and we're entering into a Medicare market and looking to partner with the payers and the providers in the ecosystem. So different markets, but I think a lot of the similar learnings probably led us into this part.
I like that. I had to ask you that, Jenny, so that everybody knows straight from the horse's mouth how this is so different.
It is so different.
So different.
We would never hire Glen at our company. I'm joking.
I'm sure he'd love to hear that. We're going to just send him this clip. Okay. The other thing I have to ask about is, the conspiracy theorists who are out there who watch you guys very closely, especially what you've done, all of you, since Livongo was acquired by Teladoc, the SPAC that you guys started. So Hemant's in the Health Assurance Acquisition Corporation, along with Steve Klasko, yourself, and Glen, and others. Does this dotted line lead anywhere?
Well, what I would say is we're always looking for the optimal opportunities, and that, as you know, is a publicly traded company, so I'm not at liberty to comment, but I appreciate the question.
Of course, and as you know, I have to ask, so I'm glad we got that off the list here. All right, last thing for you then, Jenny, what are you most excited about in terms of launching this? I mean, you announced this today, we're here at ViVE, this is so exciting. You got really great reception from people who are just I think really excited to have you back. I'm very excited to have you back. I love seeing strong female leaders, especially clinicians, lead companies. Amazing. So what are you really excited about?
Well, I am really excited to be back in an operating role. I am very energized and very jazzed. And I seriously could not be prouder of the founding team that we have today. We had a chance last week to spend time at an offsite together. And it was one of those moments where you kind of look around the room and people are driven for the similar passion and very culture around what we're delivering for people who really have a high need. So I could not be more excited to be a part of that team and to learn from the team.
That's amazing. Well, congratulations on the launch of the company. I'm so excited. We'll have to talk to you in the summer when you announce your market and roll it out. We'll get you then. Jenny Schneider, everybody, talking to me about her brand new company, Homeward, which just launched today. We're welcoming her back into the industry. We missed you.
Thank you. Thank you,
We'll catch up with you again. I'm Jessica DeMassa, and for more interviews with the who's who of healthcare as they are changing the way that we experience health and medicine, please check out my YouTube channel over there at youtube.com/WTF Health. Thanks again, Jenny.
You're welcome. Thank you. You too.